In 20 years of working with bariatric patients, I understand how confusing it can be when you're considering weight loss options, especially surgeries. So, if you're trying to learn how SADI-S works, who it's best suited for, and the lifestyle realities that are essential to understand before choosing it, you're in the right place. We'll cover all this and more in this video. What the SADI-S is. SADI-S stands for Single Anastomosis Duodenal Ileal Bypass with Sleeve Gastrectomy. It's a mouthful, isn't it? It was developed to simplify older malabsorptive procedures like the BPD-DS while maintaining strong metabolic effects. The surgery begins with a sleeve gastrectomy, which I've covered in another video, followed by a single intestinal bypass connection. SADI-S works through three major mechanisms. Number one, restriction, meaning restricting the amount of food that you can eat. The sleeve component is what restricts the stomach size. Let me show you what this looks like in real life. This is a soda can that has been cut in half and filled with solid food. Now, for most patients, this is the maximum amount of food they can eat once they reach the solid food stage of their postoperative diet. I wanted you to see this is normal because many patients are quite surprised at just how little they can eat at one time. Mechanism 2, hormonal and metabolic effects. Secondly, it significantly affects hunger hormones. Many of the cells that produce ghrelin, a hormone involved in hunger, are located in the part of the stomach that's removed during the sleeve portion of the surgery. As a result, many patients experience reduced appetite and earlier satiety. Mechanism 3, malabsorption. By bypassing a large portion of the intestine, absorption of fat and calories is significantly reduced. This malabsorption is what drives much of the weight loss and many of the side effects. What this means in real life is your body is absorbing significantly fewer calories and nutrients. Expected weight loss. SADI-S produces the highest weight loss outcomes among bariatric surgery procedures. Many patients lose 35% or more total body weight loss, with maximum loss occurring between 12 and 18 months. As with all bariatric procedures, outcomes vary and long-term success depends on follow-up and lifestyle support. Short-term surgical risks. Overall complication rates range from 7 to 12%, depending on patient factors and surgeon experience. Short-term risks include bleeding, infection, blood clots, and injury to surrounding structures. The most serious complication is a leak anywhere along the staple line in the stomach or at the single intestinal connection, which occurs in roughly 1% of cases. Surgeons take extensive precautions to test and reinforce a staple line during surgery. The next part is the most important, and it's where I see people either do very well or struggle significantly. Important lifelong restrictions after SADI-S. SADI-S has very specific lifestyle implications that must be understood clearly. Fat intake and diarrhea. Because SADI-S significantly reduces fat absorption, high-fat foods can dramatically increase diarrhea. And this is where some patients really struggle because these symptoms can affect your day-to-day life more than people expect. Patients who consume fatty, greasy, or fried foods may experience frequent loose stools, urgency, increased gas, and abdominal cramping. Over time, this can significantly disrupt daily life if dietary guidelines are not closely followed. This is not a rare or minor side effect. It is a predictable result of how the surgery works. Patients whose work or lifestyle limits frequent and unpredictable bathroom access should think carefully about this procedure. For some people, this becomes a major lifestyle consideration. Smoking should be stopped at least 6 weeks prior to surgery and is strongly discouraged on a permanent basis after this procedure. Smoking significantly increases the risk of marginal ulcer at the staple line and intestinal connection, which can bleed, perforate, and require additional surgery. Non-steroidal anti-inflammatory medications, often called NSAIDs, go by the common names of ibuprofen, Advil, Motrin, naproxen, Aleve, and aspirin. These medications increase the risk of ulcers, especially at the intestinal connection, and generally cause stomach upset. Should not be used within the first 3 months after SADI-S. Be sure to ask your bariatric team if you're allowed to take NSAID type medications after this procedure. If pain management is needed, your medical team can help identify safer alternatives. Be sure to let providers know you've had SADI-S surgery when they are prescribing medication for you. Since part of this surgery is the sleeve gastrectomy, one of the most significant issues patients struggle with is acid reflux. Some patients experience new onset or worsening of pre-existing reflux, which may require long-term medication or further evaluation. Carbonation and air intake. Carbonated beverages, including sparkling water, should be limited. Using straws and chewing gum can increase air intake and pressure inside the stomach, leading to discomfort and stretching over time. Alcohol is strongly discouraged during the first 6 to 12 months after SADI-S surgery to allow for proper healing. Alcohol absorption is altered after this procedure, and tolerance may be reduced. You will become intoxicated much faster and stay intoxicated longer. Alcohol can also cause gastric ulcers, irritate the stomach lining, and lead to liver damage because it acts as a liver toxin. In addition, intoxication normally leads to poor food choices, which derail health and weight loss. Alcohol should be discussed carefully with your bariatric team. Nutritional supplements. Because of the strong malabsorption from this procedure, daily multivitamin supplementation and routine lab monitoring are permanently required after SADI-S. Fat-soluble vitamins A, D, E, and K are particularly affected. Routine lab monitoring is essential to prevent serious deficiencies. Dumping syndrome. Dumping syndrome is uncommon with SADI-S, averaging 0.8 to 1%. This is because of the sleeve gastrectomy component of the surgery. And hey, if you're comparing SADI-S to sleeve or bypass, make sure you watch my comparison videos pinned in the video description below. They'll help you understand the differences. Long-term risks of this procedure include gallstones from rapid weight loss, marginal ulcers at the connection sites, new onset or worsening of previous reflux, stricture, and body image as people adjust to their new weight. Who tends to do well with SADI-S? Due to its high effectiveness for severe obesity, SADI-S is often considered for patients with BMI over 50, patients with BMI over 45 with a serious illness, patients with previous weight loss attempts that have failed, patients who have experienced weight regain after a previous weight loss surgery, patients who are committed to change, and of course, patients who can pass a psychological and medical clearance. Who should think carefully? Patients who have an active mental health disorder or are struggling with substance abuse, patients who are unable to commit to lifelong supplementation and labs, patients who have issues with strong dietary compliance, patients with unrealistic expectations of the surgery, patients who are unable to achieve a full medical and psychological clearance, and patients who plan to become pregnant within the next year or are currently breastfeeding. Surgeon experience matters. An important factor is surgeon experience. Complication rates are generally lower when the procedure is performed by surgeons with significant experience, often defined as at least 500 completed cases. This is one of the reasons choosing an experienced ASMBS bariatric surgeon is so important. ASMBS is the American Society of Metabolic and Bariatric Surgeons. Be sure to check the video description for a free printable PDF. It contains not only the top 3 questions you should ask a bariatric surgeon during your consultation, but also covers the details of the SADI-S. Understanding the metabolic and lifestyle realities before surgery is essential to long-term satisfaction. If you're trying to decide between SADI-S, sleeve, or bypass, check out the videos in the video description below and subscribe to this channel. I release 3 videos a week that discuss all the available options in the professional weight loss world. And remember, this information is educational. I'm a physician assistant, but I'm not your PA. All healthcare decisions should be made with your healthcare team. Thanks for watching, and I'll see you in the next video.